Namaskaram. Welcome to Arohi Ayurveda Wellness. I am Dr. SWETHA, an Ayurvedic physician, Ayurvedic nutritionist and yoga instructor, currently working in Dhanvantari Ayurveda Bhavan as assistant physician. Today, I am privileged to share with you the wisdom of my beloved Guru, Dr. C.M. Sri Krishnan, who is one of the finest Ayurveda Vaidya who practice Ashtangas of Ayurveda in our country with more than 30 years of experience in the clinical practice. Even though he practices Ashtangas of Ayurveda, he is known for his excellence in the field of dermatology. He is not only an excellent Ayurveda Vaidya, but also an inspiring mentor who inspired and continue inspiring millions of young Ayurveda Vaidyas all over the world. Hope you enjoy and learn some valuable knowledge through this small conversation. Namaste, I am Dr. Shweta. I welcome you all to my channel Arohi Ayurveda Wellness. Today we have a special guest with us. He is one among few Ayurveda Vaidyas who is practicing traditional Ayurveda in our country, and he is the former professor and HOD in Department of Toxicology, Kottakkal Ayurveda College. He took voluntary retirement and currently working as Chief Physician and Managing Director of Dhanvantari Ayurveda Bhavan, Nelluvai. I'm so humbly welcome you, sir. I'm so honored and blessed to be your Shishya and be in this institute for 3-4 years now. And I want to start my journey just with your blessings. So let's start. First, I would like you to introduce Ayurveda to my channel.
Yes, Pralam to all. I'm very happy to be in this channel because my one of the favorite Shishya, Shweta, is offering her own channel, and it is a very good initiative because the channel we are spreading the knowledge, Ayurvedic knowledge, the knowledge, and also how to be in a good life. That is very important nowadays. So I wish all the best to her through this channel. More people should get awareness about a healthy lifestyle. So we are in a present era, then we can say the post-COVID era. The health status, we have to think about the pre-health COVID area and post-COVID area. So in this post-COVID area, Ayurveda is very, very important, and also getting more and more important, not only in India but also the whole world, because the lifestyle is very, very important nowadays. So Ayurveda advises how to be healthy and happy in physically, mentally, socially, family, financially and spiritually. This is the health definition of Ayurveda. Especially it is very relevant for the post-COVID era. WHO is also giving importance to all these 5 areas. So how to keep a healthy lifestyle, that is at present era everybody want and also everybody need. So this type of YouTube channels is very important to spread the real Ayurvedic principles by which we can maintain a healthy lifestyle. And I appreciate my Shishya, Shweta, and wish all the best for a very good developed YouTube channel so that more and more people can observe or can get her knowledge. That's we are starting. Okay.
Knowledge is coming from you, sir.
Thank you. Yes, come on. Now what else we have to give the people?
So I am connected to the Dhanvantari Ayurveda Bhavan for 3-4 years. Now I am seeing lot of patients are mostly coming from the dermatology department. Yes. Skin related problems are spreading nowadays. So I want you to spread light on the topic of changes happening in the dermatology pre and post. Means the condition which you were seeing in your early life, and now what all the changes are happening in the modern stage in aspect of patient, the disease, and in according to a doctor.
Yes, that's a very good question, because since by the last 30 years I was in the actual period of this practice, pure Ayurveda, scientific and traditional Ayurveda. Now regarding there are several departments in Ayurveda. the dermatology is one of the very important, and it's very difficult to manage also. You have to identify the patient correctly, and you have to apt the medicine. Then only you will get the result. So nowadays, the most of the dermatology problem is lifestyle, because the hard and we hard. But the food and the life is very important. The food is very important for maintaining our skin health, because the skin is the largest organ which will be exposed to the nature. So we have to protect our body as per the nature. So any changes in the nature and also any changes in the food habit, we have to maintain a natural food habit, natural lifestyle, etc. Especially food, sleep, and mental status also. So these three is completely changed. So the new types of dermatology problems are coming. So most of the disease I can tell you now, especially psoriasis and lichen planus and allergic dermatitis, that means related to immunity. So autoimmune diseases are increasing more in the dermatology. The infectious diseases are previously very important, like dermatitis, pustular dermatitis, infectious, bacterial infection like that. So when compared to maybe 15 years back, the infectious influenza specific bacterial infection, the bacteria we need specific antibiotic, basically antimicrobial medicine. Now, by the usage of over microbial drug, the skin resistance is lowered. Now in this era, we are getting more and more non-inflammatory dermatology problem. I mean non-infectious dermatology problem. So that coming in from the body, in Ayurveda it's called nijam. The previous is called agati. So the nijam that is cause is internal. Internal cause is due to the improper food habit, especially with the ahara. And also the improper sleep pattern. And also mental. These are the three important factors for the causative factor of the newly developed dermatology problem. One thing, the people are engaged only inside, especially the work at home. Most of them going work at home. So work at home, morning till they are not going outside. So we are lacking the sunlight and the natural air. With the lack of sunlight and the natural air, our body resistance is lowered and lowered. At the same time, they are taking lots of non-veg and improper food and virudahara and incompatible food, especially in the improper time. We should take the food in the proper time, in the proper manner, in the proper way. Then only that will be metabolized and we will get the nutrition, especially the skin. We have to give more and more nutrition. So the skin contains more blood circulation to the skin. So if you are lacking the nutrition, the skin nutrition will be lower than the results will be lower. That will cause the autoimmune reaction in the skin. Secondly, we are not exposing to sunlight. The natural vitamin D is lowered and the skin resistance will be lowered. And also, even though they are sitting inside, they are using several cosmetics. The newly developed cosmetics with some chemical is causing easily allergy to the people. So that is present there in dermatology is important in the post-COVID era. The improper food and improper sleep and also the mental tension. Because they are not having a good family life. And only work overwork. That lowered the resistance and this autoimmune disease are increasing. So we have to maintain a proper food habit, which will nourish the skin, which will be more good for the body. We have to give proper sleep and proper exposure to the nature, and also make calm and quite stress-free mind. These are the important in this era as per the dermatological problem concern.
I have a doubt that you said to be exposed to sunlight, but the thing is nowadays we are getting lot of patients with solar heat allergies and all. So they are knowing that the sunlight is needed, but the thing is atmosphere, there's so many studies going on, the ozone layer is depleting, so the direct sunlight is going to harm the skin. So instead we all the dermatologists suggest to use the sunscreen, which we are seeing having another adverse effect to the skin. So what is that which Ayurveda can do to overcome this?
Yes, actually exposure to sunlight means not severe sunlight. Morning, from the sunrise or the early sunrise we have to exposure. Previously, every morning we are waking and we are walking. So the early sunrise will be very good for the body. So that we are lacking. We have to expose the body and early sunlight for half an hour, 1 hour. And the usage of sunscreen is not advised by the Ayurveda. Instead of the Ayurveda advises a proper oil for application, especially coconut oil. Or in the Gulf, they can use olive oil. Olive oil or coconut daily do abhangam into the skin and then the skin resistance will be more. Then that will be act as a sunscreen. Don't use any chemical included sunscreen. That will cause solar allergy. And secondly, what is nowadays the people are taking a lot of allopathic drug for BP, diabetic and heart problem. In Kerala it is more because they are adding several chemical drugs. if they are taking continuously, after a long period of using, that will cause cumulative toxicity. That will cumulative toxicity, the capillaries of the skin will be dilated. So that dilated capillary will be lower the resistance of skin. And in that patient, that due to the capillary dilated, easily the sunlight will cause allergy. So that also we can prevent by application of daily applied coconut oil. Or any prepared prepared coconut, if they are applying this, we can prevent.
Whether it should be applied during the morning, that when you are going
before
outside.
bath, morning or even before bath. Morning is good. Before bath, just 10 minutes. Everybody will think the application of oil will take more time. No, before bath only 10 minutes. Then they can take a bath. So if you apply daily that coconut oil, and the coconut oil contains some enzyme and some fatty acid, that will be very good for the skin. And here nowadays we are using soap without applying the coconut. So that soap being alkaline will deplete the sebum from the skin. That sebum and seborrheic acid sebum is good for the resistance for the skin. It is actually the sebaceous gland of skin will protect. It's a natural barrier. We are removing that by applying the soap. So if you are removing that, you should apply some oil. By that we can resist the sunlight and can prevent the further complication.
Another doubt I have is nowadays we have a lot of medical technologies, including AI is coming to the dermatology section to identify. So we see patients with that they have diagnosed as psoriasis, and what we see as a doctor from clinical aspect is showing different. So how much relevant is the AI in this field?
Human artificial intelligence.
Yes.
Actually, I don't think that artificial intelligence is very important for the health, because the mechanic he will not be able to diagnose properly. We had to analyze the patient by their lifestyle, their food habit, mental by only proper interaction. We have to see, we have to feel, and we have to talk. And because some dermatology problem, how it came is very important. Much what I told you, the dermatology is the lowering the resistance, and that coming from the blood impurities. That comes from the food. The food comes from the proper digestion. The proper digestion depends upon your mental makeup also. So as per Ayurveda, dermatology problem, whatever it may be, it can diagnose even like blindness, even like eczema, or psoriasis, or Panchakarma, all the disease we have to diagnose the appearance and the etiology. Even though the model, if they are autoimmune, they are only giving out for immunosuppressant medicine. All the diseases they are giving in the allopathy also immunity immunosuppressant tablet. We what in Ayurveda, we are cleaning the body. Total body purification. By that we are stimulating the metabolism at the cellular level. By that it will be increased. That is our principle. So I think this AI has no role in the diagnosing and treatment of dermatology nowadays. Because it is only, we are again going to mechanical, and we are taking some medicine that will cause other problem. Because very important, liver is very important. So liver is the metabolism, metabolic center, and if you are strong liver, that liver is protect your skin, because in the liver that's made up of several layers. The superficial layer will actually protect our body. So from the deepest layer, that multiplication and metabolism should be correct. That depends on your liver capacity. So we are taking a lot of chemicals inside, either in the food, either in the medicine like that, and that will cause the lowering of the liver metabolism. That's actually causing the dermatology problem. So I don't think the artificial intelligence, of course, we can do, but artificial intelligence only.
Information is feeded by the experts in this field.
Even by the expert, each person is different. Each person, suppose one medicine here, it is some body dermatology boils for them. But maybe the treatment, it will be by the exposure of that severe sunlight. Secondly, the menopausal stage, the ladies will come out to 40 years. Or the age-old people are taking this several medicines like aspirin like that will be another case. For the child, it is an atopic. So this different arm that only a creative mind can do, then only we can give exact medicine. I am not giving single medicine each patient. Each patient that we are, as per the condition, we are giving some different medicines. So I think the modern, but if applying the medicine, if any technology, so you can use. We are using the spray. That's the technology. But artificial intelligence in the medical system, as per my opinion, I don't think that is more relevant in the clinical practice.
You said the psychology and the dermatology is interconnected, and can you explain?
Actually, the dermatology and the mind is very much connected, both in anatomically also. Because when any stress, that stress causes the capillary dilatation in the skin. The stress, and also the stress causes some brain overstimulation. So the stress will lower the resistance of the skin. That will cause very easily by the disease. Why it is? The skin contains two parts, epidermis and dermis. From the embryological stage, from the embryology, it is multiplication and changing to a different tissue. So, there are three layers in the embryology: ectoderm, mesoderm, and endoderm. The skin epidermis is developing from the ectoderm, from where the central nervous system is developing, and the dermis is developing from the mesoderm, from where the intestine is developing. So, the intestine and the nervous is very much connected to the skin. That is the Viruddhahara, erratic food habits affecting the lowering the resistance. Also, the tension will cause nervous system limited, that will cause resistance lowering the skin. So, these are connection with the stress and the skin.
So when the skin-related peoples come, the patients have a very difficult time. They are passing through a very drastic, both familially, their surrounding also is having a pressure.
Yes.
The patient itself is having a pressure. So we suggest them to come out of the stress and relax. But many of them don't know how to come out. We just suggest them that you should come out, otherwise it's not going to, the cycle repeats. But how to come is always...
Yeah, that's a very good question, but the problem, they want to come out of that. So diagnose first, and we teach them. The people when in Ayurveda, merely giving medicine is not a treatment. When the dermatological problem came, you have to analyze the patient and make aware about this. We have to. This is the cause of your disease. So this is the problem, and you have to have maintain this type of life. Then, if they understand, then they will come out. One example, suppose this we can do melasma. Say 40 years old lady come with a melasma, and maybe she is working also. So normally she had some work stress, also menopause stress, and maybe both are working in the family also, there will be some family stress. So these three stress will cause this problem. And we have to teach them. Actually, melasma is due to these three factors. Stress, both mental stress, work stress, family stress, and maybe 40 years they will be well settled by a huge, they will be borrowing some money from the bank, everything. So financial stress will be there. So they are in a dilemma, they are in a stressful, irritable stage. So first we have to tell, this is the cause. Unless you are not like, this will not clear. Medicine is not work okay. Of course, some is release valid. We have to give medicine, proper medicine, advise them. We have to release by relax. Relax. Menopause is issue, they can have outing with their spouse, and they have to proper communication with their spouse. Both physically and mentally communication, we have to teach them. Then only the stress, when stress is cleared, this will be very easily curable. And we are telling them, it will be clear by this, they will try for that. And also a good do some counseling to the members of the family also. Then if they have collective work, they have to communicate properly in the family, even children also. And suppose in this area they will be very angry someday, and children don't like it, then we will quarrel. So even children also, the most probably the children will be in the teenage in this way. So tell the teenage also, this is the problem for you, don't take quarrel. When the husband also, all the three family have to do counseling. Then give medicine, then they should be relaxed and they will be very effective. That type of approach Ayurveda is clear.
Then another major doubt among the patients is how long it takes to cure this skin disease.
Actually, if you are diagnosing it properly and if you are giving proper medicine, the patient is very important. If they can train properly the food and habits and proper lifestyle, very easily within 40 days, I was mandalaka. I know medicine within mandal. That is 40 days, most of the disease is diminished.
There is so many misunderstanding in Ayurveda that once we are giving Snehapana, the cholesterol is getting increased. Then the rasa preparation what we are giving is going to harm the liver, kidney, and many other factors which you see that which is affecting the patient's mental condition when they are taking the medicine. Actually, the
misconception regarding the Ayurveda, it is widely spread. One is from the patient, one is from the society, and nowadays Ayurveda is getting very important. Ayurveda is accepted worldwide. So I think some area is work against Ayurveda to demoralize the Ayurveda treatment and medicines. It's going on, I think. Actually, every medicine, if there is an action, there is a problem. Suppose a paracetamol is here, it will have an adverse reaction. If you are several allopathy drugs have its own reaction. Ayurveda is also a drug have also a reaction when it is action. But when we are using the properly, when you are using the proper condition, the proper dose, there will not be any problem. Actually, the adverse reaction of Ayurveda is depends upon the condition. And some medicine, especially the problem coming to resorption. Actually, resorption is a medicine. We are not giving resa as such. We are, and everybody is talking about mercury. We are not using mercury. In the herbals, mercury, sulfur, and magnesium, zinc, also we are using. So this is we are giving not as such. We are prepared in a specific manner, Smaranam Shodhanam. And if we prepare in the Ayurvedic point of view, that medicine will not contain any gross particles of this matter. And we conducted one study regarding this copper. When prepared the copper, tamra basmam, copper basmam, and we analyze in the ISRO when we are doing some research in the PG level, and we give this medicine to ISRO, and they are telling that there is no content of copper, there is no proper content in that basmam. That means we are converting the copper or any resa preparation or metal into the ionic stage. Yes, that we have to study. If there is something you study, it will convert to the ionic stage. That ionic stage is entering in the cell very easily, and we are getting good results. Suppose gold, we are using gold. Previously, the modern pharmacology is also giving gold in the pemphigus or like autoimmune is gold injections again. And that nobody arises this question. Why this time arises the question? We are giving Sarna Basmam, Saras are all containing gold. But nowadays in America, one university analyzed the Sarasati. They are telling that these Saras are not containing any gold. But in the gold atom, in the nano micro particle, they are not able to make it such a nanomolecule from the gold. So that's our preparation. Your preparation is good. There is no harm to the body. There will not any problem with it. That's a misconception and mispropaganda against Ayurveda by some group of area and people.
And about the cholesterol?
Cholesterol also. Actually, regarding the cholesterol, it is a foolish idea regarding the cholesterol. But I'm not telling. I'm not telling by myself. You know, Dr. PGDAN, the famous doctor, is also some thinker also. Is not PGDAN, the allopathy doctor on the. He was very good, very excellent, very society respected also. In his autobiography, he wrote a book. In that, he told that the cholesterol about the discussion is which is a fool thing. And the LDF, HDF, they have nothing to do. Actually, this made by some companies to increase their product. The seminar conducted by the people in the doctor will come and of course, some cholesterol is needed to the people. And if you are taking ghee, normally by taking the ghee cholesterol in ghee, it will not increase, we are taking proper cholesterol. The animal fat will increase the cholesterol. Proper ghee, again cow ghee, and the ghee if you are prepared will not increase the cholesterol. We conduct one study. 50 people we conduct a SNEHA bank for different and we after and before we check the cholesterol. Surprisingly, the cholesterol level people will have normal cholesterol, high cholesterol level also have normal cholesterol. So we are conducted. So, but at the same time, you don't use over fatty food. Like if you use over fatty food, if you are not doing any exercise, the cholesterol increase. But when it is beyond 300 or 400, it will cause some problem. It will cause some, and I will call it Damani Pradya, Adi Brahmana, Adi Stulada. So that we have to reduce by other method. Don't bother if the Ayurvedic medicine will increase the cholesterol. From my experience, I have been 30 years experience. And when I am taking this last 10 years experience, because after taking the VRS, I have fully engaged the morning period. Approximately 10 minimum per day we are checking 50 people daily. We are sitting in the office. 50 patients per day we are consulting. And approximately on 1 month, 1,000 people. 1 month. 1 year, 10,000. So calculating from the last 10 years, 1 lakh patient I have consulted and managed successfully. 1 lakh people from the last 10 years. So from my experience, I have got several new information. It's very important. But at the same time, if you are, the preparation is also important. Nowadays, Ayurveda preparation depends upon the gridam coming from other side. So that gridam or ghee should be proper.
How can
that should be very proper. If you have warm in you have to make pure cow ghee and prepare that is good. That is Ayurveda mistake. That is medicinal preparation mistake. You have to get a proper medicine if you are using no harm to the body, no cholesterol. And secondly, one thing, if you are taking the medicine for the cholesterol, especially allopathy, that will cause adverse effect. Because that will reduce the fatty content of the brain also muscle. And then there's some chronic myalgia and the brain atrophy will come. I have observed several people. Brain atrophy, myalgia, and weakness. That caused the overusage of cholesterol medicine. Then.
What will be your advice to the people who are so caring about their skin and they want a bright, super duper skin? What will be your advice?
Actually, the skin, I told you, skin, the exposure body. Everybody wanted beautiful face and skin. Wonder, don't use any artificial cosmetics.
What is your secret?
Yeah, my secret, I told you, proper food, proper sleep, stress-free mind and life. Secondly, the skin, respect the skin. And respect the skin. You have to respect the skin. Don't irritate. Do pacificate. Don't irritate. That is to be a good personality with a cute and beautiful fair skin. Proper food, proper sleep, proper life, and a stress-free mind. Ayurveda is a treasure of ocean of knowledge regarding the health. It is lifestyle. I want to advise not to worry physically, mentally, familially, financially, socially, and spiritually well-being. In all the aspects, you can get advice from that. That is one more
inspiration.
You continue spreading this knowledge of Ayurveda. The world is wanted that. Real knowledge from the Ayurveda, the people are eagerly waiting.
Real knowledge from the great gurus. Let's start. Okay. I need your blessings.
Okay, being my Shishya, definitely she will grow. This channel will be accepted by the wide range of people. I'm sure because she had a good capacity for the communication and for getting the knowledge, everything. Okay.
Thank you, sir.
Thank you. Okay.
Thank you.